Leslie is also backstage with board-certified plastic surgeon Dr. Joubin Gabbay, who's performing a new cosmetic treatment that claims to achieve a more hourglass shape. So, Leslie, what's happening in the other side of the room?
Well, we all know the big butt trend isn't going anywhere soon, super popular, but no pun intended. What it really comes down to, I think a lot of people miss, is the hips. The rounded hips really create that hourglass shape. And if you take a look at, let's say, Kylie Jenner when she was younger versus how she looks now, her rounded hips really contribute to that overall aesthetic, that beautiful feminine physique.
Absolutely.
And we're not saying she had anything done, but there's no denying how beautiful that looks. So Dr. Gabbay is here with his patient, Natasha, and we're going to perform a hip dip procedure to get rid of her hip dips. Now, you don't really see it right now because she's lying down on her side. So tell me about the anatomy of hip dip.
Sure. So the hip dip is actually an area between this top ridge of the pelvic bone and the bottom end here we call the trochanter of the hip bone, the side of the hip bone. In some patients, there's not as much fullness in that area, be it a lack of muscle, fat, or whatever. Now, actually, in Natasha's case, we've already numbed this area, so it's a little bit more full than it normally is.
So tell me a little bit about the product in your hand that you're going to use to fill in these hip dips.
So this is called Sculptra. It's actually a granular powder made of the same material we use for our sutures in surgery. It is something that we have used all over the body, and in this case, it acts really as like a fertilizer for the soft tissues of wherever you put it in. We put it in with liquid. It comes in nice and full. After a little bit, that fullness goes down temporarily, and the fertilizer effect starts kicking in and stimulates the body to create its own tissue, collagen, other good soft tissues that can be quite long-lasting and give it a nice change to a formerly deep area.
But you say that fat is still the gold standard for this type of procedure.
Definitely. Fat is your own product. It is something that in many people who can use it, there's a lot of, and it is really long-lasting. So it really is the gold standard. It's the best product.
Well, why don't you go start injecting and tell us what you're doing?
Now, I know that Dr. Gabbay is good because I helped train him at UCLA, so there. So, Doc, it's all about that hip-waist ratio, correct? Different ways of skinning the cat. You may want to thin the waist with liposuction, as you said, or augment the hip. We love using fat. We don't like removing fat. But in a case where somebody doesn't have a ton of fat, Sculptra is a great alternative.
Absolutely, and that is exactly it. And that's where Natasha is really a classic patient for this procedure. She's very slender. She doesn't have a lot of fat to give for an actual fat transfer. So this becomes a great product to use to fill in those areas.
Natasha, do you actually feel that going in?
A little bit of pressure, no pain.
So what are you most excited about after you get this procedure?
I'm actually getting married in October, and my dress
Nice.
is very fitted.
Congratulations.
Thank you.